No one has experienced the COVID-19 pandemic like doctors and nurses who have been on the front lines since the beginning. Some healthcare workers say their days feel like deja vu. Newswatch 16's Nikki Krize spoke with the critical response nurse at Geisinger about her pandemic experience. That's tonight's Healthwatch 16 report.
Healthwatch 16 is sponsored by Geisinger Health System.
Years into the COVID-19 pandemic, healthcare workers are still rising to the demands of treating the sickest patients. For some doctors and nurses, it's starting to feel like Groundhog Day.
I've never feel anxiety before I go to work, and I do now. I have for the last 2 years.
Autumn Yordi is a critical response nurse at Geisinger Medical Center near Danville. She worked in an intensive care unit for 14 years and responds when patients are coding.
We go support staff nurses on the floor, on med-surg floors. We help them if they need help with high acuity patients.
Autumn says her job has changed a lot in the last 2 years. Her days are now spent with COVID patients.
I watch them go from being normal, you and I just needing some oxygen, to getting worse. And then they end up spending a few weeks in the ICU, or if not longer, until they just can't take it anymore, or the family decides, that they don't want to put their loved one through this anymore.
Autumn calls the last 2 years devastating and says it's taken a toll on her and her coworkers.
It's made all of us question what we're doing. We still want to be nurses, and we do, because this isn't why we got into it. We got into it because we made a difference and we helped patients.
They have seen a lot of people die.
I can't even begin to tell you a number of how many people that we've seen, not make it through, that we transferred from a med-surg floor to ICU.
Autumn says the majority of the patients she sees in Geisinger's intensive care unit are not vaccinated against COVID. She wants to encourage people to get vaccinated. Nikki Krize, Newswatch 16.